Hi, and so nice to be here today. My name is Maria Möllergren. I work as Senior Advisor at the National Board of Health and Welfare in Sweden. And in that role right now, I'm working full-time with a project that we have based on a government assignment, where we have a support for public actors in Sweden who want to cooperate with Ukraine within the fields of health and social services. So this is a work that has been going on for a year, and we have some practical projects that are going on both when it comes to hospital cooperation, but also when it comes to developing social services. Children and young people is one focus area where we have a dialogue and cooperation that is starting up. But today I'm not going to go into detail in that, but instead I will present a little bit more about the role of the National Board of Health and Welfare, what we do. And I have chosen the National Board of Health and Welfare is one of the big government agencies in Sweden. There's 1,000 around people employed at the agency. And we have a broad mission when it comes to develop Swedish healthcare and social services. And in doing so, we have several tasks. It involves following up, evaluating, and examine how the health system and social services are working. One part is also knowledge transfer, developing guidelines, recommendations, and so on for healthcare and social services. And also one part is developing norms, so binding regulation based on legislation taken on by the national level. We also have other public tasks, such as performing licenses for the professions that work in healthcare. And also crisis preparedness is one other area. And I just wanted to show this picture, which is the model to develop good healthcare and social services, where you see we have the whole circle when it comes to analyzing what is the problem, what is the best available knowledge, how can that be used in the healthcare system, both on a local and regional level, and then following up with statistics, evaluations, and then using that to make developments and improvements. And this we do together with other Swedish agencies, but also the regional and local level. So this is a way of working together to get the results, good healthcare and social services for the entire population. So this is like the overarching work and goal. And I'll just show this very quickly, but here we have the common goal in this work is, of course, to have a good healthcare and social care in Sweden for the whole population. That is accessible. Christine mentioned several words of these. Accessible, knowledge-based, safe, patient and user-orientated, efficient, and equal for the whole population. Today I thought I would focus on three areas that the National Board of Health and Welfare work with. So one is how we work with data registers and also social services, and focus on the health data registers. I know this is something that you are interested in. And we are one of the authorities in Sweden that have official statistical databases. And here we also have material in English. So I will also send you some links where you can get more information. But some of the databases we have statistics on abortions, cancer, causes of death is one register. And the statistics are presented by year, gender, age, geographical area, and also for socio-economic groups. So it's a very broad source of knowledge when it comes to developing the healthcare and social services system. Here we can see in detail what is the state down to the local level in some areas, and also then aggregated on a national level. What is the developments? Where can we see that we have problems, and what can be done about it? Yes, so national health data is of course important for policy making, for the government, for the national budget, to follow up government initiatives. Justine mentioned some of the initiatives that are taken, for example, when it comes to accessible care. So that needs to be followed up to see what is the situation, how does it differ. Research and development, of course, is also uses these data. And then public reporting, and I will show you some of the reporting we do at the national board. But this also means that we have a transparency on how does it look in the country and in the different sectors. So here you can see a list of the health data registers that we have. And one strength with these registers is that they have existed for several years. So it does allow for over time follow-up of the development. I won't go into details, but as you can see, cause of death register is one important. We have it when it comes to dental health, national patient register, medical birth register, cancer register. So here there is a lot of data that is used for evaluations, but also for development. And I just wanted to show this slide as well when it comes to the registers that exist for social services. So for example, there's a national register for substance abuse. There is also a register when it comes to for elderly and persons with impairments. So this is a list on those registers. And I know we're short on time, but I wanted to send you, all these reports are available in English. So if there's any areas you're specifically interested in, and I'll share these slides after. There are links to all these statistics where they are presented in quite a short report in English. So you can see here, you can see the latest numbers from 2024 when it comes, for example, to statistics on health and medical service of municipalities. That maybe could be of interest just to see how it's presented. But also we have, of course, the causes of death register, this big register. And all the statistics that's Svegla can find on that link below. A few words when it comes to then performance assessment. So of course the statistics are used in these works. But system performance assessment is based on statistics, indicators that are relevant, information from municipalities, county councils and regions. Surveys are regularly sent out as well with more specific questions on information that can be found in the registers. And the aim of this is, of course, to improve the quality, to develop different care systems or social services. And it is an important, it's supposed to be also support for management and governance, both on the local, regional, and national levels. So these performance assessment can be used as a tool as well to see where are we lacking in our area and how can we work to improve. Just very short, that it's based on, the framework is based on international framework. So indicators from WHO, OECD, it's adapted to Swedish context, and there are specific set of indicators developed in the Swedish system. So this is in Swedish, but the purpose is, of course, to measure the quality of the healthcare. And to do so, there are indicators looking at the individual needs, but also how the care is built to be accessible, with good quality, those overarching indicators that Justine mentioned is important when developing healthcare. But then also looking at background factors. So what is the population structures in certain areas? What are the socioeconomic conditions in the area? Political, economical conditions, and so on. So it does form quite a comprehensive picture based on that system. And here I'm just showing an example on one area when it comes to an assessment that's been done in the health system. Here are 6 overarching questions that are used in, I think, the latest report. So one question is, how much are we paying for healthcare? Is the healthcare sustainable? And here it looks on factors such as AMR, use of antibiotics, is one indicator in that area, for example. Do we have access to healthcare when we need it? What are the waiting time, accessibility of care? How well is healthcare contributing to keeping us healthy? So what was mentioned earlier, the prevention. And what is the quality? And the last question, are we getting healthier and are we living longer? The question of also the lifespan. This is just for me to show how the indicators are used. So if they are broken down into 14 core indicators, and then the development is followed. If it's green, it's going according to plan, it's developing, it's improving. Yellow, it has stagnated or stopped. Red is, of course, there we have a problem area. Now I'm showing a picture of indicators where it looks pretty good. I know that there are other pictures there, but most indicators, the core indicators, they are going more or less according to plan when it comes to these 14 that are being followed. So that was a very shortly on system, and I'll be happy to send more information because I mean it is a complex area, but there are so much that can be used in that area. What I also wanted to mention is the work when it comes to national guidelines as an important tool to make sure that for certain diseases the population in Sweden get the same care wherever you live. So national guideline has as purpose to ensure that people have access to good health and medical care and to even out geographical differences, as I said. And it's also to support health professionals when it comes to prioritizing the right interventions, but also to contribute to efficient use of resources. So in doing this work, in what areas are national guidelines being developed? There are criteria for that. It needs to be severe chronic illnesses. It's areas affecting a large number of people. It's a high cost for society in these areas. And there are large regional differences. So these are some important basis for developing national guidelines. It can't be done in every area, but it's done for some of the larger disease groups. And they consist of key recommendations, assessment of recommendations when it comes to financial, organizational consequence, and also indicator and targets level. And it's all published online. And that's also a link I can send you. Not sure how much we have in English, but I think there are some. And just to give a concrete example on how they can be used. It's, for example, that, I mean, it's looking through research intervention that are proven to be efficient, but then also to make a priority list. What interventions, and they're structured from a scale to 1 to 10. So to see what are the most efficient evidence-based intervention in this area. And here's the list of 19 national guidelines that have been published. I'm not quite sure if it's completely updated. I think there might be maybe some missing. But here you see in what areas they have been developed. So abuse, addiction, dementia, Parkinson, MS, schizophrenia, stroke. So in all these areas there are these national guidelines that are developed together with the regional level as well. So there's a process, it's quite a structured process to develop these national guidelines. And last, I just wanted to show very quickly some of the work streams on disability and rehabilitation. And here we have gathered material to support social workers, people working in the social services, where you can find statistic, terminology, information on rules and regulation, and all information when it comes to social services, and divided also in different areas, can be found on a web-based guidance, kunskapsguiden, where the Swedish, we work very closely together with Sala as well in this issue. But here we can have a gathered source of information for people working in the social services. So this was a super fast.
Thank you. Thank you. I think the million-dollar question for this study visit is the differences in health between sparsely populated areas, glesbygd, and urban areas. Are they diminishing or increasing?
And here I would need to have one of my colleagues that have actually been working on it.
Yep.
But all the tools I've showed you, they will show them those differences. So maybe you have the answer, or you will have the answer this week.
Well, I'm not sure if I have an answer on that one, but you know from the past that often, you know, the remote and rural areas, sparsely populated areas, had a higher life expectancy, but this has now leveled out, and I think you live longer in the cities today. What that depends on, we are not sure. But we have the same guidance, we follow the same guidance. The challenge for a remote, as you know, that works in remote and rural areas with healthcare, is that we have the same responsibilities as a city or an urban dense area. But we have, like when you will visit Storuman in Sweden, where my unit is based, we have 6,000 people living there in a very large area, 0.7 person per square kilometer. So we work in a very different context from Stockholm, where we are now. But at the same time, we need to use different tools to compensate for the long distances. So we use a lot of digital tools, digital service models that are helping us to provide access for the population. But we still see some differences, but we can't say what it depends on. So most likely the national guidelines are providing an equal basis for health and care in Sweden, but we don't know the difference why they are existing.
Thank you. We have two new guests. But we will have coffee before that.
Yes.
Okay. Do we have time for one question?
Not one question, the comments, and I have and we give a little gift. Okay, Maria, I speak Ukrainian, okay? Я дуже вдячний за інформацію, і насправді дуже багато питань у нас є, і вони ще будуть. Я хочу зараз заручитися вашою згодою на подальшу онлайн-комунікацію, і, можливо, більш широко після того, як ми вивчимо всю інформацію, дізнатися про роботу вашої агенції і особливо по роботі з даними, статистикою, оскільки в результаті децентралізації, на жаль, у нас зараз і створення нових громад, у нас втрачена можливість керувати здоров'ям громади на основі даних. І нам потрібно зараз вибудувати цю модель, яка у вас працює. І тому ми будемо дуже вдячні для подальшої особистої комунікації, щоб та можливість, яку ми або вимагаємо від громад щодо управління здоров'ям громади, вони мали таку можливість, спираючись на дані і приймаючи рішення на основі них. А сьогодні в нашій делегації є представник Національної служби здоров'я України. Вона є якраз старшим спеціалістом з візуалізації даних аналітичного відділу Національної служби здоров'я України. І я запрошую її передати вам невеличкі сувеніри від...
This is a small gift from Ukraine. Your experience and knowledge is very important for us. Thank you for your work and supporting Ukraine.
Thank you so much. And I will send
Сфотографуйте, да.
I know this was short, but we are really happy to continue. I have a more comprehensive presentation when it comes to our work with statistics, and I'll make sure that you get my contact details. So just contact me, and if we can provide more information, we will be happy to do so. It would be very interesting. Thank you so much.
І ще питання, Марія, якщо ви не уходите, ми коли фотографію спільно зробимо, можливо, тому що уходять представники, а ми таки не зробили спільно.
Ми потім вмонтуємо в
Ну,
фотошопі.
дивіться, можливо, варто зараз це зробити, якщо будуть.
Of course.